أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. Today is the very hottest topic. Is the heart attack. Heart attack. I am talking about the heart attack. Worldwide, 17.9 million people each year die from the heart attack worldwide. Estimated it become the 31st population of the world. Heart attack and vascular disease, cerebral vascular disease, the group of disease including the coronary heart disease, rheumatic heart disease, and other few conditions. Fourth from 5 cardiovascular disease. Result is the heart attack, and maybe it lead to the death. The highest rate of the people having the cardiac vascular disease, having a hyperlipidemia, hyperglycemia, overweight, obesity. These are the factors which cause and tobacco smoking and genetic factor, predisposing factor, and sedentary lifestyle, and overweighting and overeating, and low physical activity. These are the factors which causing the cardiac vascular disease. A lot of primary health care facilities are available around the vicinity. The people are identifying those people having the high risk of cardiac issue or cardiac event. They should visit to the primary health care facilities and arrange the test regarding the cardiac disease. And now we are talking about the definition of the angina pectoris or heart attack. Angina pectoris is the medical term. Medical term is the angina. Result is the discomfort find out on the chest, and usually the blood flow toward the heart as become low, less, as heart muscle is need high consumption of blood and oxygen consumption. So resulting is the dyspnea and excusing chest pain, people having a high pressure like a pain on the chest, and also can be aggravate on walking. There is a maybe stable angina and may not be unstable angina. Unstable angina is the relief from the stable. Unstable angina is the relief from the nitroglycerin given to the patient beneath the tongue. Yeah, spray we use the nitroglycerin. And stable angina also we can use the nitroglycerin. It is the prophylactic treatment And here is the four type of the medicine. And Disprin hai, aspirin, we can give to the patient 165 to 300 mg, and four tablet of the clopidogrel. Each tablet contain the 75 mg, and also we can use uh, 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 the angicid, nitroglycerin tablet. Uh, in differential diagnosis of the chest pain is the 41% of the chest pain usually due to gastrointestinal tract, GRD, maybe GERD, and maybe gastritis, and 31% coronary heart disease, and 28% due to musculoskeletal pain, myalgia, maybe arthralgia, and 2% of the pericardial pain. These are the differential diagnosis of the chest pain. And normally the two types of the uh, chest pain: classical chest pain, typical chest pain, and atypical chest pain. Often doctor misdiagnose, and patient also uh, think himself become a misdiagnosed, and sometimes patient having a chest pain but he doesn't feel, he's thinking something like a gastric pain, might be chest pain, and might be gastric distension pain, but in real it was a chest pain. So that time, if the patient is age 25 or 30 years old, and family history is the positive of the cardiac pain, heart attack, and also obesity, a history of smoking, a history of blood pressure, if he bearing a chest pain, may be typical and may be atypical chest pain. They should be they should immediately, if they have a Disprin, he can use for symptomatically eliminate the pain. If he having a nitroglycerin, he can use in emergency condition, so subside the pain. If he have a clopidogrel tablet, so he can use the collectively for medicine at the time. So this kind of act made the patient reduce the mortality rate. uh, and if we are talking about the Pakistan, Pakistan mortality rate of the cardiovascular disease in 2019 in Pakistan, 46% people were dying uh, uh, due to cardiac disease, and each hourly. Before 3 years back, the quantity was 12 patient each hourly death, and after 3 year it become fourfold. The main reason was the physical inactivity. There was people doesn't do the on daily basis physical activity, and they doesn't eat a fresh fruit and fresh vegetables, and it doesn't make a habit of 30% daily spend time for walking, and also it doesn't take participate in the uh, cricket, football, and other type of game which make the heart and body healthy. So right now a lot of burden, and day by day in the Pakistan also the mortality rate due to heart attack is becoming a higher. It is a very alarming condition. uh, Alarming condition. uh, so right now the people should, if you want to make a heart healthy, so you should spend 30 minutes daily for walking. You should check daily your lipid profile. You should avoid the heavy junk meal, and you should avoid the oils and ghee and fatty products, and you should take become a vegetarian, and you should use the in diet as sea product and meat, and avoid the beef. And also you should take a physical activity, and like a cricket, hockey, football, this kind of activity you should take a part, so your heart will be healthy, and you will be your physics and mental health will be healthy. There will be a less stress, and you will be avoid from the various kind of uh, psychological illness that exacerbate and aggravate the heart attack. So hopefully you will get a lot of information, and you will do the healthy activity for your heart, and you will avoid from the heart disease and vascular disease like blood pressures, this. And in the last, I would like to say, avoid the smoking tobacco, and avoid the junk food, and avoid the cold drinks, and control your weight according your height and age, and taken part in the uh, physical activity. You will be, inshallah ta'ala, become a healthy and wealthy. Hopefully you will get a lot of information regarding the heart attack, and as well as sign and symptoms and medications and lifestyle modifications. And hopefully you will like and also subscribe my channel.